It's great to see everyone bright-eyed here. I know last night was a beautiful night, and some of you are here late, some of you are coming in late, so thanks for getting here so early. It's particularly exciting to be here, and congratulations to Emids. I remember for those of you, how many were here at the first meeting? Anybody? Second meeting? The early meetings? So it was a very, very small group, and to see this conference, it's something really to be proud of. Well, we're excited to be here today, and this is a particularly fun panel for me because one of the things I've talked about continuously is two words to focus on. One is experience, and the other is alignment. And everyone on the panel today is really here talking about how we're redefining not just digital swim lanes, but how we're redefining the experience of healthcare. And I think we're all aware of the need to improve health and care and that experience for what some people call traditionally patients, what we call health consumers, and also the caregivers who support them. And so, our goal collectively has to be to make healthcare less confusing, less complex, and less costly than it's ever been before. So maybe the first question that I'll ask of each of you is, in thinking about how we improve the health and care experience, maybe we'll start on the end. Aaron, what's your North Star when you think about it, when Amazon thinks about it? How do you think about that experience that you're trying to create?
Yeah, I think for us, it's just basically a matter of doing the things that we've historically been good at. So making kind of things that should be easier. And it's a pretty kind of, we have a pretty kind of narrow focus, I would say, from that point of view. So we're really thinking a lot about access, navigation, and engagement. And one of the things that I always kind of talk about is, 2 years ago, when Haven wrapped up, Rod Hochman, my prior boss at Providence, asked me, when is Amazon going to get serious about healthcare? And I said, well, it's when they hire, or they put into place, they pull the healthcare businesses under a single senior leader. So this is, in this case, Neil Lindsay. And I swear I said this. And I said, ideally, that person would be somebody who ran Prime prior. And so Neil did run Prime. And the reason why that's so important from our perspective is it's the only consumer-facing business that we've got, really, that's got a longitudinal relationship with consumers. So it's a subscription-based business. It's all about engagement. And then there's kind of an inside Amazon kind of, inside, how the machinery works is to run that business, you have to be really, really good about coordinating other businesses together to where they present a coherent whole to the consumer. And so I think that gives you kind of a sense as to, what our North Star is like, how do you make, given, kind of the scale that we have, probably even some pretty small, transactions and interactions a little bit better, could really kind of help a lot of people. So giving, just a small percentage of people more access, for instance, may help a lot of people.
I heard you told Rod that they also needed to hire a senior health systems executive.
Yeah.
You just didn't tell me.
Yeah. It was an awkward conversation at that point, 2 years ago. So.
Mario and Oscar, your whole kind of purpose in some respects was redefining this relationship for individual health consumers with their plan, with their health care. So tell us a little bit about the North Star for you, and has it changed?
Yeah, so we try to keep that very, very simple. Healthcare has triple aim, the quadruple aim, and so that can all be very confusing if they have to manage and balance all these various outcome optimizations. And from my point of view, the biggest thing that the insurance company should be doing is make care more affordable. That's it. I mean, all of healthcare really just lower the costs. That's the biggest issue I think the US healthcare system has. It's the biggest thing that gets in the way of better quality outcomes. If you start there, that's a great North Star. All kinds of statistics, recent study about, I think, a $10 higher copay on drugs and Medicare leads to a 30% higher mortality rate. I was looking at our own internal costs for PCR COVID tests versus over-the-counter COVID tests, and the PCR tests on average $150, right? Over-the-counter on average $10, but the spread of pricing on over-the-counter is $1, like variance up and down. Spread of pricing on PCR is like $60, $70, meaning any part of healthcare where there isn't a consumer focus, the costs start going out of whack and starts becoming very unwieldy. So for us, it's really drive affordability. Now, that's the theoretical goal. The practical way to do it, I think, is through member engagements, right? For example, we see that in our virtual primary care plan designs, so when, as an Oscar member, you pick an Oscar medical group physician, and that becomes your virtual primary care physician you're attributed to, when that doctor gives you a drug, or prescribes you a drug, the drug becomes free. It's part of our plan designs. And that little thing of taking the drug copay from $10 to $0, basically, and then having that conversation with the Oscar doctor directly drives drug adherence from 65% to 85% or so, right? So insurers can make care more affordable, but they need that connectivity into, ideally, the member to make sure members end up getting care in the right place of the healthcare system, and then you can put more cost pressure on the system.
Well, you know, I've been a big fan for a long time, and we found the same thing at Livongo, my prior business. When we made strips free, health improved. And so if you make it easier for people to stay healthy, and we also know from an even earlier business at Allscripts that the higher the copay, the less people pick up the scripts. And so who does that hurt? It hurts the underserved. So this is an equity issue and an access issue and an affordability issue. So Anita, you've been 1 year now at Walgreens. We all know Walgreens. It's been around forever. That's where we go and get our scripts. But it's a lot more. You're taking it in a whole new direction. So tell us about the new North Star. And in some respects, everybody knows the name. We think about it in one way. So you have to you've got a different task of kind of reorienting people a little bit.
Yeah, no, as you mentioned, we've been going through a significant evolution just about a year ago. And I'll start with, and I think this is really important, I'll start with our purpose. And that was the change that occurred. And so it's very simple, but it says, more joyful lives through better health. And so think about two words there. One is health. So I think from our perspective, our North Star is, us as a retailer, us as a pharmacy, we really want to play in health. And then you don't think about healthcare and joy together, typically, right? You think about quadruple aim, triple aim, all of those. And so at the fundamental piece, it's how do we create joy? How do we create just a meaningful interaction? And to do that, we firmly believe that healthcare is local. And you deliver local health and wellness. And so for us it is, how can we become the partner of choice? How can we deliver healthcare in a very local way? Really thinking about a very personalized experience, so it's not just about the footprint, it's not just about the Walgreens pharmacies, but how are you building an experience that's very, very patient-focused, that's about the whole person care, because it's all, right? It's behavioral, it's mental, it's financial, it's all of those. That's whole person. And then how are we doing it in a way that really is collaborating and working with best-in-class partners? We'll never own everything. We won't, we really believe at the core of it, neighborhood healthcare that's equitable. And that's a big piece of what we're trying to do. It's equitable, accessible, and has a great experience when and where the consumer wants it.
And so do you think, just follow up on that, and then maybe I'll ask Aaron, you the same question. So when we think about healthcare, I think all of us would agree that the existing healthcare system, as I referenced earlier, if you survey people, they say healthcare is more confusing, more complex, more costly than ever before, and it's getting worse, not better. So we all, I think, can agree that healthcare as it stands today needs to be disrupted. And yet, if you think about Walgreens, you don't necessarily think about Walgreens as a disruptor. And in fact, you don't even think about today, given Amazon's size, as a disruptor. Mario and I, disruptors. We're new to the game. We created new names for new businesses.
Losing money, making money, that's the difference.
That's right. If we all get together, maybe that's why they put us all on one stage. So, but tell us, how do you think about disruption? Is Walgreens a disruptor? is, and how do you think about that?
Yeah, I would say, to your point, it's hard to be disruptive when you are an extremely large organization that's rooted in a core business that's been extremely successful. For us, I would say disruption it comes in two ways. I think about it in two ways. One is challenging the status quo of really where healthcare is delivered, how it's delivered, and by whom. And I'll tell you, the pandemic over the past 2 years really put a spotlight on that for us. As most of you know, retail pharmacies played a huge role. We administered more than 72 million vaccinations, over 35 tests, largest pediatric provider. And so that really taught us that, yes, we're known for pharmacy, but we can do more. We've got the brand, we've got the credibility, we have the loyalty, and the ability for a interdisciplinary care team to do more and expand those services further than pharmacy into primary care, into post-acute care. So that's one aspect of disruption, which is care can be delivered different ways by different people. Second is this notion around moving from a transactional relationship to a longitudinal, and I think you said that, which is it's not just about coming in, picking up something from the front of the store. It's not just about picking up your prescriptions. It's how do we make sure we are with you across that entire care continuum, and we're actually connecting in with different providers. It's not always our providers, it's other providers, and bringing that seamless experience. So I think those are two aspects of disruption as I think about our business and how we've evolved. And we've traditionally been, it's all about the face-to-face, and we've invested a lot in digital, we've invested a lot in technology, making sure that our approach is really omni-channel. It's not just about the footprint.
Aaron, you're a little bigger than a startup now. And yet, every day is day one, right? So how do you think of yourself as disrupting healthcare, and what do you think the biggest disruptions are coming?
Yeah, I think the thing that was really intriguing to me about Amazon's opportunity in healthcare is around, improving access, engagement, and navigation, and also just kind of like weaving in healthcare to kind of everyday life. Like the healthiest people I know, it's just some part of what they do every single day, right? And so if you can kind of make that kind of easier for a consumer, I think that's really interesting. And I will also kind of make the point that when I was at Providence, one of the big things that we kind of worked on was, access, so kind of improving the ability to do things self-service as a health system. And one of the areas that we really started work on, before I left Providence was around engagement. And the reason why engagement matters so much in healthcare is if you get a customer highly engaged digitally, it's easier, from an insurance standpoint, for instance, to kind of ask them questions, to nudge them in the right direction, those types of things. The other thing, too, is the existing engagement channels are frankly dying. So emailing and calling people is not effective anymore. So, people don't want that kind of engagement from traditional healthcare. They want it to be kind of seamless and, part of their daily lives and that kind of thing. And so I think that's our opportunity, is to kind of help in that, kind of small way on that, peripheral part of healthcare.
Well, Mario, let me jump to you and ask a question. It's kind of a fun one because you and I were on a panel at Oliver Wyman, and one of the analysts was saying you introduced something a year ago and it didn't work, and now you've shut it down. Mm-hmm. And they looked at that as a negative, and I was like, this is great. That's called learning. That's called trying new things. That's what happens when you innovate. That shows you're good. You could have kept doing it and been like every other status quo company, but you didn't. So talk to me a little bit about the lessons that you've learned in terms of that idea of innovation, trying new things, and balancing that with how much change is out there. How do you do that? How do you do that in the public eye?
Yeah, to be clear, I would prefer that everything work that we do. But I think it is a very mad idea to start a health insurer in the US healthcare system generally, because there is almost no advantage you have, and the incumbents are pretty much more advantaged at everything, right? More capital, more provider relationships, and so on. The one thing that startups and disruptors can do is they can try stuff more quickly. There's less legacy, fewer legacy relationships, fewer legacy contracts, and things like that. I actually remember that when we launched our first network constructions in New York. There were other New York-based insurance plans who couldn't go to particular health systems and get narrow network contracts because their contracts prohibit them from doing that. And so that was a very clear way of getting into this market, doing something different that others couldn't do from a structural perspective. So in other words, if we don't do things quickly and shut stuff down quickly, we give away the one advantage we have vis-a-vis the incumbents. And therefore, it's a deep part of the ethos of the organization. I think it takes two different things. One is it takes organization commitments to that. And so one of the ways in which we do that is that everybody at Oscar has access, almost everybody has access to building their own dashboards, which means you can get deeply into the data, and there's all kinds of access controls, of course, nowadays, right, and some SDLC documents and so on. But you can get deeply into the data, and you can monitor your own part of your business by building your own dashboard. And I think we have built about 5,000 dashboards in our history as a company. Of course, I have a dashboard of dashboards where I can look at the dashboards that exist. And about, I think, 500 people at Oscar, which is, right now a quarter of the organization, have built their own dashboards. And that becomes a very powerful way of getting people used to, you have your own little thing that you built, and you got to keep watching it and keep improving it, and so on. So that's one part in which we think about fast, failing, and moving, and so on. The other one is really about just looking what works and what doesn't, as you said. And if something doesn't turn out to be right, be more quicker at shutting it down and not going through with it. I think that right now in healthcare, over the past 15 years, when capital was so plentiful and cheap, you were incentivized to do more rather than less, and that has completely changed now. I mean, there really is, and I don't think this will ever. Not ever, but it will not come back for a number of years. The startups can just go and open their hand and get cash put into it and start doing new things. And so if you don't now have a very good idea of what your footprint should be, what you internally should do, what you're good at, and then what you should do with others, so let others do for you, I'm convinced you're going to fail. And for us, this means, for example, that we've been fully focused on the Affordable Care Act markets. That's what we've been doing well for 10 years, and we're going to just keep doing that in a really good way. And then we can use our successful products there and lease them out in our platform strategy. For example, campaign builder to run campaigns for people, things like that. But that's it. No large group market, no other things we don't already, no Medicaid, no other things we don't already do.
Well, Aaron, I don't want to just pick on Mario saying there's some things he tried and then he stopped and he shifted strategy. Not that that's happened at Amazon. So Amazon Cares start off. Now you've pivoted. Again, being an innovator, I think that's a good sign. I think you try things until they work. Edison said, "I never failed. I just found 1,000 ways that wouldn't work until he invented the light bulb." So Amazon has a great history of trying things, but has that? How do you think about that in terms of this new venture? And then in the new economy where we're trying as hard as we can to cause a recession, we're telling everybody, stop buying, stop hiring, because we're going to have a recession. And if everybody follows that direction, we will have a recession. But the economy's not cooperating. It's still staying pretty healthy. So we'll see what happens. But how do you continue to innovate? What's involved in that decision to pivot on such a big initiative?
Yeah, I think what's interesting is the best meetings I've ever seen at Amazon have been where you've had a successful business, so that's not shocking. The worst meetings I've had is where you've had an unsuccessful business, but it's clear that the management team didn't learn anything from that experience, right? The kind of in-betweeners, nobody's like, let's be realistic, nobody's celebrating that something didn't work, have been around, like somebody got really deep insights as to what to do better or different, the next time. And I think, I'll never forget the gentleman that now runs what we call stores, which is, the vast majority of our business at Amazon, a guy named Doug Harrington. Back in my first kind of, tour at Amazon, he did this amazing kind of debrief on their experience building what was the kind of primordial version of our grocery business, right? So we had this pilot of kind of home grocery deliveries happening, I think, in Mercer Island, and like a very small, thing. And it took forever to get it off the ground and get it profitable and that kind of thing. And it was the most, out of any meeting I was ever at over those 8 years, that was the most valuable meeting I think I was ever at, because it was like this really detailed kind of breakdown of like what they learned, what you can learn from it, when you're starting businesses and that kind of thing is phenomenal. And then the other thing I would tell you is, Amazon's history is all about the pivot. So like figuring out like, okay, how are you using this technology, and then using it for surprising and different ways that, didn't work the first time, but really worked the second time. So for instance, little known fact, but back in the day when I first started, we had just shut down a very unsuccessful business. Believe it or not, Amazon had an auctions business at one point. And that's the reason, like, I bet you if I surveyed this crowd, 0 of you would know that they had an auctions business. And back then, Amazon was very concerned about eBay, right? And so they built an auctions business, and nobody came. And I'm not exaggerating. Literally, like, I think statistically, the people internally came and tested it, but nobody did an auction on Amazon. That platform turned into the 3P business that we now have. So FBA, marketplace, where we sell third-party products, alongside our retail business, which is now 60% of our total overall kind of retail, stores business. The second example, is pretty famous, is, the Fire Phone, which again, how many of you knew that we actually sold a phone at one point? Again, if you bought one, you're very rare. You should probably hold on to it because it'll be a collector's item one day. The technology inside of that became Alexa, right? So we always kind of look for kind of the bits and pieces of things, that work and try to reuse them, repurpose them. And then the last thing I'll say is we also try to, as long as you're learning, right? And that's the key thing, because if you make the same mistake over and over again, you're just being a bonehead, right? You're not learning anything. But if you're learning from your mistakes, we try to lower the cost of failure. And so, for instance, when we, wound up Care, I think the day that we did it, we replaced 80% of the team internally, right? And so it's one of these things where it's like, and then we're, making progress in placing the rest of them. So we're trying to kind of lower the cost of failure as long as you're learning.
It's just a quick example on this one. Reutilizing cores of technology that you build for different purposes is an incredible aspect of technology companies and startups. And like in our case, for example, all of the member campaigns and provider campaigns we run on a system called Campaign Builder, and that was originally our rules engine for our claim system. And so, kind of reutilizing a totally different way because it's all rules, and you can repurpose them, you can automate them. So
well, I think that what we learned from all of the quote-unquote failures are really what you can take out of them. One piece of the kind of initial founding of Transcarent came from Haven. And that is looking at Haven, and a lot of people look at Haven and say, well, here's 3 of the biggest, smartest companies in the world that failed. And in fact, it wasn't a failure. They just decided to do things in a different way. Amazon didn't exactly retreat from healthcare, and neither did JP Morgan Chase, and neither did Berkshire Hathaway. But I think one of the learnings from that was there's a problem that large self-insured employers and mid-sized self-insured employers don't feel alignment. And last but not least, we had to consumerize healthcare. So at Transcarent, with some help from some of the folks who came from all over the industry, but in particular from Haven, this idea of creating a new, better, and different health and care experience that, 1, put people in charge, and 2, aligned with large self-insured employers. You could probably take that, almost lift that out of Haven's playbook, and that's some of what we did, along with a lot of push from people saying they had the idea right, they just, for a variety of reasons, it wasn't executed, but it's still needed. And so I think out of every one of those, if you look at failures in your own businesses and look at them not as failures, but as learnings, I think we can gain a lot from that. Let's talk about another absolute disaster called the pandemic. And so the question is, what have we learned from the pandemic? And interestingly, I think when you look back 10 years from now, 20 years from now, we'll think about the terrible loss of life, and we'll acknowledge that. We'll look at the economic damage that was done, although in the scheme of things, that will actually be a blip in terms of the overall economy, not individually. We'll look at the mental health issues, which I think will be the longest standing kind of legacy. But there'll be one other long-standing legacy, and that is the adoption of digital across the economy. And I think particularly in the US, people will look back and say that's when the pivot happened. So for example, if you look at the use of currency in this country, it's down 70%, 7-0. People have migrated to using their phones to buy things, using touchless systems, et cetera. In healthcare, more than half the population has now used digital health, generally in a telehealth scenario. And so maybe, Anita, start with you. When you think about the use of digital health, and I think of digital as bringing abundance, which is it makes it easier for everybody, inner city, rural, to access healthcare. When you think of digital at Walgreens, you have this enormous footprint, almost every corner, right? That's what people grew up with at Walgreens. How do you blend digital into that? How do you think of digital as helping to bridge the divide in healthcare?
Yeah, it's a good question. I'll say during the pandemic, the few things we realized was, one, we had to accelerate our digital efforts, our technology efforts. So the ability to meet customer expectations like they would from an Amazon. I need my COVID test delivered within 2 hours at my doorstep, right? I want the over-the-counter test. I mean, we had to accelerate that where you now have the ability, if you don't want to go in the store, you can have it delivered in that time frame along with all the other health and wellness products you want. So that's one example. I would say we also realized that it didn't work for everyone. And I'll give you an example. My 81-year-old parents, when they had to go sign up for their COVID test, had no clue how to get in and enter everything they needed to. And that does represent quite a big percentage of the customers we see. And so what we did was we took innovation and we took those services out into the road. So, we equipped buses with capabilities, our technicians with iPads to be able to do it. So I do think you have to be aware of it's not one size that fits all. I would say the second piece that we took a really close look at, and I recommend this highly for everyone, is think about what your core strengths are, build that, and then partner with others. So during this time, we realized our internal tools were critical. We have 102 million consumers on our Walgreens, My Walgreens app. The ability to leverage that data, the ability to help them find and schedule care was important, so we were going to invest there. And then we partnered with others, and we've made investments in primary care and post-acute care. Those were areas we had to decide, that's not our core strength, we don't want to build it, let's partner. So I would say as I think about digital, you have to realize that especially in medically underserved area where you don't have access, you don't have broadband, making sure you still have mechanisms by which people can receive care. We're in 46% of our pharmacies are in medically underserved areas. The other example I'll give you, my colleague Ramita is here who leads clinical trials. During the COVID, we realized, and I think we've all known, less than 5% of the US population participates in clinical trials. And of those who do, 75% are Caucasian men. They don't look like me. And so how do we actually open up both digital and our stores to improve access to a very important area like clinical trials? So I really think it's a balance of both and figuring out where you really want to double down.
So it's interesting, and Aaron, I'll go a little off script here. So your strength sometimes is your weakness is your strength. So you have all this physical presence, and not long ago, people said, well, gosh, bricks and mortar, you want to move away from bricks and mortar, okay? And then the flip side of that is, can we do healthcare without bricks and mortar? And the answer is no. So what we need is not a digital solution, we need an integrated health solution. And so Darren, if I look at Aaron, on the other side of that equation, you have great digital assets, but you don't have a physical presence. Or you have less of one, and yet you're changing that. in some respects. Talk to us a little bit about that.
Yeah, I think, one of the reasons why we're super excited about One Medical, if and when it closes, is it's the kind of omni-channel part of what they deliver. And the reason is because you have to have the broad scope of practice in primary care, right? So it's really, really hard to say, we're going to do everything for you except for these 5 things, right? Or these 10 things. It has to be pretty comprehensive. And so that's the first thing. The second thing is that's really exciting about them is just really great customer experiences. That's the number one thing that we care about at Amazon is very, very high NPS scores. And so I think it's incredibly important. Like one of the things I always kind of think about when I think about primary care in particular is you've got to earn the right to get to the next stage, right? And it's an evolution, and it's really hard to skip steps, right, in your learning. So step one is we always, when I was back at Providence, we talked about perfecting the online transaction, right? So how do you create a great online kind of transactional experience? Then you get into primary care, which is, all right, now you've got basically these series of transactions, if you will, or these series of engagements and encounters with the patient, where you've really, now it's a longitudinal relationship, right? And that's very difficult. Then you earn the right to have, more of a say in kind of downstream care. So that's care management, right? So saying, okay, now I'm going to build kind of a high-performing network and those types of things. Then you earn the right to take risk. Then you earn the right to do things around kind of those models that, things like doing things at home, right? But a lot of times in kind of healthcare, people get things out of sequence and they don't work, right? So I think that end state is this omni-channel in your home, in clinic, virtual, all these things need to be kind of working together in a cohesive whole for it to make sense to the consumer. And then the last thing I'll say is about the post-COVID kind of, retrograde of telehealth. I think a lot of telehealth was kind of, I certainly think that parts of Providence did this, and when I talked to other health systems, this happened as well. It was kind of glued onto the existing infrastructure. It really wasn't kind of this kind of seamless experience. A lot of people kind of, just delivered Zoom really, really quickly in their primary care engagement. So it's no wonder that a lot of consumers kind of reverted back because it's a very clunky experience. So you have to kind of get that experience really, really kind of nailed for it to stick.
So I want to push back in one respect, and that is I think we saw digital go to 100%, and then it dropped back, but it went from 5% to now between 20 and 30%. So I think we've seen a pretty big jump. But you make a really good point, and that is we can't 5 years from now have digital health. What we have to have is health that includes digital. Just like today, we don't have digital banking. You don't say, I'm going to go do digital banking. In fact, it's almost flipped. I took some flack because my youngest son has never been inside a bank. Someone said, what a bad father you are. You've never. So I asked him, I said, are you bothered by the fact you've never been inside a bank? He said, what would I do inside a bank that I can't do on my phone? And so I said, see the vault? And, but other than that, no, not really. So, so then he gave me a lesson in crypto. It got bad after that. Talk to me about, I want to push back on one piece of what you said, and that is One Medical, strategically it makes a lot of sense because I read one of the analysts, this may or may not be right, but there's an 85% overlap of people who go to One Medical and shop at Whole Foods. And that's great for a very small segment of healthcare that frankly is probably getting pretty good care already. Mm-hmm. How do we get to the rest of the population? Now, I think it's going to be helped, by the current administration infrastructure bill, which will make, digital assets more available to underserved areas. So that's a good, helpful thing. But how do you do that in your strategy?
Yeah, I think you've got to have the context and the maturity of the business engaging in healthcare, right? So keep in mind, like my boss has been there since January. I've been there since March. The place that you don't want to kind of learn how to learn healthcare is in the Medicaid dual space, for instance, right? Like you don't want to start in the kind of PhD course. You want to start with like, a population that you're very familiar with and that kind of thing. But I will say that like, I think, what we're very, very focused on is kind of the mission aspect of this. And like, back when I was at Providence, people used to ask me, wow, it must be very different kind of working at Amazon and working at, Providence. One was like at that time, less than 20-year-old organization, and the other is a 165-year-old organization. I said, yeah, they're different. Don't get me wrong, right? But there's some kind of similarities in terms of like the focus of the mission, different missions, but kind of, somewhat similarities. So like, for instance, Providence had a mission of like this all-encompassing serve everyone, especially the poor and vulnerable, right? So to your point, Amazon has this very kind of focused mission on building the best possible customer experience. And I think, what you'll see over the fullness of time is us starting to kind of enable some of these other areas. But again, I think we're very, very humble in understanding what we can kind of take on and the complexity of the work. The first place you don't want to, and also there's huge downside to messing it up, right? So for instance, like, if we decided to start off in a very complex space like Medicaid, duals, and that kind of thing, God forbid we do a bad job at that, right? That would be tragic. So I think, what we're kind of taking very small steps, very humbly moving into the future, understanding that we're kind of new to healthcare. We don't have the experience of a Walgreens and that kind of thing, and being very kind of, conscious of that. So, and again, we're very early, day one, into the entire healthcare work that we've been doing. Up until now, keep in mind, all these different businesses that we've had in healthcare have been kind of experiments, have been running out of different parts of the organization, and have not been under kind of a single kind of leader under Neil.
So we might expect that Amazon might want to take this to scale at some point.
At some point, yeah, possibly.
One thing real quick on this question. I think there's a lot of opportunity in the existing frameworks and infrastructures to make care more compatible with people's needs and getting more access. For example, only I think about 10% of provider roster files have provider ethnicity on them. And so it's very clear that provider ethnicity actually can be a very important marker for matching the right patient to the right physician. And so that's not a particularly difficult change for health systems and provider groups to make, to start sharing more of that data. Language internationalization, similar one when we entered Florida as an ACA market. I think we had the first Spanish-speaking customer service, and brokers started standing up and giving standing ovations, which is an odd sort of like shortage to have in Florida. And finally, something like the brokers, actually mentioning those guys, healthcare insurers tend to look at them as necessary evil in a sense, right, and sort of a part of the cost structure. But in markets like ACA, they are unbelievably effective spokespeople that have gotten local church communities into healthcare coverage, and you can use them to get back to members and create more engagement. And I think that's how, even within the existing framework, there's more value to be gotten out of using them differently.
Nita, you've also, at Walgreens, made some acquisitions, some pretty large ones. How do you think about putting those assets together so it's not 4 different experiences, it's one integrated experience? Because I think we could all agree, that's what people are looking for.
Yeah, as in all large organizations, we have process, we have a team set up for integration, but all of that aside, I would say the guiding principle for us around bringing all of this together has been put the patient, the customer in the middle, create those member and consumer journeys across that entire continuum. So almost what Aaron was talking about, wellness, pharmacy, primary care, post-acute care, palliative care, end of life, all of that. What's that journey look like? And at what points are we bringing in Village MD from a primary care, CareCentrix? I'll give you a great example. Right after a hospital readmission, CareCentrix can help actually find a primary care physician. Almost 30% of Medicare beneficiaries that leave the hospital don't have a primary care physician. That's a staggering number. So now CareCentrix can actually refer them to a Village MD prescriber and schedule the appointment. So that's one great way of actually bringing the assets together. The second, I would say, is along the same continuum, referring them to Walgreens, where you can now do a medication reconciliation. Again, decreases hospital readmissions by about 20%. So that's how we're trying to bring all of it together, but really putting the patient in the middle.
Great, super. Well, we're just about out of time, and so I have a question. If you had to pick one winner, and it was not Transcarent, I'm taking Transcarent completely out of this, but one winner not on the stage, who would you pick in the health and care space to be a winner? Who wants to go first? Not on the stage, sorry.
Not on the stage?
Not on the stage.
I mean, who is winning? I think, for good, bad, or indifferent, probably United and Epic. I mean, and
Okay. I was talking about innovation. Okay. Okay. That's going to get me in trouble. Mario? Mario?
You did not clarify, to be clear, who's winning.
We'll come back to you. We'll give you one last word.
Well, okay, this is kind of a cheeky question. I'll give you a cheeky answer. So I banned the term AI from my public earnings calls because every Excel regression is now AI or whatever. But I will tell people that in the last 6 months, everything that's been happening in large language models and generative AI and so on is incredibly mind-boggling. And it is a completely anti-rules-based system, and healthcare is probably the most rules-based system that exists, and so that could have interesting implications. So if you ask me, I would say the robots will win, and people should check out DALL-E 2 and GPT-3 and GitHub Copilot, just to play with what's going on there right now, and it really will blow your mind. So that's my...
These are not the answers I expected. Okay. Anita,
I'll say,
keep us running
Well,
here.
I'm going to say, can I say that I was bribed to say Emids? But no.
There we go.
Yeah,
Nicely done.
I don't think there's a single winner, quite frankly. Our healthcare is fragmented, it's expensive, it's not consumer and patient focused and centric. So I do think the winner will be the organizations that can win over trust and collaborate really well across. And there isn't one that has emerged, in my opinion, as innovative to do all of that yet.
And I would say, there's they once said that if they asked Willie Sutton why he robbed banks, and he said, because that's where the money is. And I think when I look at who's going to win in healthcare, I say, where are the people, where are the customers? And so not on the stage, I would say Walmart. And because when you can, and I don't think of Walmart as big tech, I think of them as big customer. Like I think of Amazon as big customer, like I think of Walgreens and CVS as big customer. That's where people are already going. And we've got to make healthcare easier for people. And so what's easier than where you already go to? So you go to Amazon, 200 million people a week go to Walmart, millions and millions of people go to Walgreens already. So if we can incorporate that into the solution, we can make it easier. And who can help us do that? Emids. No, I was also paid to say that. No. Thank you all very much for listening. Hopefully this was helpful. Thanks, everyone.